An Australia vaccine researcher, Professor Petrovsky, who has developed and been administered with his own COVID-19 vaccine, says he is facing the sack because of his refusal to get one of the government-approved jabs. Nikolai Petrovsky has developed a vaccine called Covax, which completed Phase 1 trials in August last year and had since completed Phase 2 and Phase 3 trials. And results show it is far safer than any vaccine approved by the TGA, and better at preventing infection with and transmission of the SARS-CoV-2 virus.
A team of 14 developers from Flinders University have been working on the potential vaccine, which is based on a synthetic protein, meaning it doesn't require patients to be injected with the live virus.
So you can't get an infection from our vaccine.
A blood sample will be taken from the trial patients to see whether the dose induces antibodies to kill the coronavirus.
Petrovsky tested the vaccine on himself before injecting it into a single person. Comparatively, Pfizer's CEO, Albert Bourla, began administering an investigational vaccine on April 23, 2020. Bourla won't get his Pfizer vaccine dose until March 21, 2021.
Thank you very much. And indeed, it was like yesterday that we had this discussion.
Have you taken the vaccine, sir?
No, I haven't taken it yet.
The vaccine, which is based on a protein produced in insect cells and not an mRNA vaccine, has been approved for use in Iran and was now looking to see if it could get approved in Australia. However, his university has suspended him and threatened him with arrest if he enters his office for refusing to get vaccinated with a TGA-approved vaccine. Whereas he was immunized with his own vaccine more than a year ago. The Australia TGA has recently recognized the Chinese vaccine Sinopharm and the Indian Covaxin vaccines as effective. Yet the TGA refuses to look at Petrovsky's Australian vaccine until he pays a fee of $350,000. Petrovsky has had to team up with an Iranian manufacturer to produce his Covax vaccine, and is using a GoFundMe site to raise the $350,000 to pay the TGA fees. Professor Petrovsky has cited corruption at the top of the Australia government as the reason why Covax vaccine he developed has not been given any limelight. Professor Petrovsky explains in details in the following video.
The well-worn catchcry, follow the money. Pfizer and Moderna and the big pharmaceutical players, they obviously have a lot of funds to throw at this. Do you think that that is influencing the government at all?
So we've had a number of, influential people, including members of the current government in Canberra, who themselves thought that this was just a simple miscommunication problem and went into bat for us, including going into Minister Hunt's office on multiple occasions to ask why the government wasn't supporting our program. At the end of all of those discussions, and they came out, I have to say, with a bloodied nose, because they were told to stay out of this business, their response to us in terms of what they had found is they said, Nick, you're simply not paying millions of dollars to the Liberal Party's, lobbying firms that are closely associated with the party. And those lobbying firms are being paid millions of dollars by Pfizer and AstraZeneca. And basically, unless you're prepared to match that and fund these liberal associated, lobbying companies, as they're called, your vaccine is never going to get supported by the current Australian government. I mean, I was shocked, to me, and, I think to every Australian, what that is saying is the whole system is corrupt. And that's not a word as a scientist or a clinician I use lightly. But, that's the advice we got from a member of this government.
Please like the video, share, subscribe and turn the notification bell on. Thank you.